The following program is sponsored by the Medicine Center Pharmacies.
Welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist and the Vice President of Medicine Center Pharmacies, and our special guest, Debbie Adams-Shumaker, Manager and Licensed Speech Pathologist at Mercy Therapy Services, and Dory Moore, Licensed Speech Pathologist of Mercy Therapy Services. Good morning, ladies, and welcome to the show.
Morning.
Good morning. Thank you.
June is Aphasia Awareness Month. Aphasia is an impairment of the language, affecting the production or comprehension of speech and the ability to read or write. Aphasia is always due to brain injuries. Most commonly, it is from a stroke, but it can also arise from head trauma, brain tumors, or infections. This morning, we're going to talk with Debbie and Dory about the diagnosis, treatment, and recovery from aphasia. We'd like to remind our listeners that today our program will also be available on our podcast, which can be downloaded from the App Store on your mobile phone. Just look for Health Matters with the Medicine Center Pharmacy, and you can take any of our programs with you anywhere you go anytime. If you have any questions today, you could post them up on the Facebook post I had just posted today. We don't have our live feed working, but we will look for your questions.
So, Debbie, we understand you are a manager at Mercy Therapy Services. Tell us a little bit about yourself and your clinical background.
Okay. I graduated from the University of Akron with my master's in 1981. My first position was at a freestanding rehab agency in Akron, Litchfield Rehab Center, where I worked with adults and children on an outpatient basis. I then joined Mercy in 1987, so I've been there about 32 years now, and I've had varying roles at Mercy. I started as a staff clinician, and then I became manager of just the speech department, later manager of our rehab therapy services, which include PT, physical therapy, occupational therapy, and speech therapy. I then became the manager of our outpatient therapy services at the hospital, and most recently I've been promoted to a position to where I manage our off-sites, several of our off-sites, especially New Philadelphia and Carrollton, where we have therapy services there as well.
And Dory, you're also a licensed speech therapist at Mercy Medical Center. Tell us a little bit about yourself and your experience and your clinical background.
Sure. Thank you for having me. I graduated from Bowling Green State University in 2007 and then went on to get my master's in speech pathology from the University of Akron in 2009. My first job, I worked at a contract company with both adults and children, and then started my career at Mercy Medical Center in 2011. I currently work on the acute care floors at the main hospital and also at the Inpatient Rehabilitation Center, working with adults with speech, language, cognitive, and swallowing impairments.
So what is aphasia? Never heard the word before, which is kind of sad. And is it a new term?
No, it's
that they applied to this disorder or not?
No, we learned about aphasia, way back when I was in school in 1981. I think, again, it's an uncommon phrase. Mostly people refer to it as a disability or a disorder of communication that can affect not only expression, I think that's the most common thing people think of, but also reception, how well a person can understand. They may have difficulty understanding yes-no questions or simple commands, or just following directions. That's a big part of it, as well as the expression. Sometimes the patient will have difficulty finding the word they want. They know what they want to say, but that word just will not come out. Sometimes a different word will come out. So, for example, they may want to say cat, and the word dog comes out. They may be aware of that error, they may not. And then sometimes with aphasia, you have what we call neologistic or jargon speech, where it's mostly nonsense syllables. They're not recognizable words. Again, the patient is not always aware that that's happening. It can affect reading skills. Many times the ability to read and comprehend the written language is affected, as well as writing. They're unable to remember how to sequence the letters to spell the word or write sentences, sometimes even forget how to write their own name. So,
What about success rate? I know that there's various levels of brain damage. Okay.
yeah, I think,
I guess if I were you, I'd go home at the end of the day, and if I had a patient that did make no progress with, I thought, gee, I didn't do any good today. What what happened? Or gee, I went home and this guy was great. He knew new words and
yeah.
we got him. Whatever.
I mean,
Did you take it home with you?
I do, pretty much, yes. Because, again, to lose your ability to communicate, I think that sets us apart from all other species, the ability, and it's what our life is surrounded by, our family, our friends, our work. That ability to communicate and loss of it can be very devastating. And an aphasic individual can show a lot of frustration because of that. As far as success rate goes, I think that's so variable. No two strokes are alike. No two brain injuries are alike. People will recover at different rates. It's dependent a lot on the age of the patient, motivation, family support, whether they've had other pre-existing comorbidities, general health with diabetes, heart disease. All of that plays a role in recovery.
Interesting.
Okay, so we know that you mentioned already aphasia can be caused by a stroke. Can you talk about some other instances of causes? And I guess I'm thinking about traumatic injuries, but I'm sure you're going to clue us in on what's possible.
So aphasia can occur anytime that there is damage to the brain in the areas where language is held. So the frontal, temporal, parietal lobes generally, usually on the left side of the brain. Anytime there has been damage, whether through a stroke or through, like you said, a traumatic injury such as maybe a fall or a motor vehicle accident, aphasia can occur. Also from a brain tumor or even from a degenerative disease, such as the beginning stages of dementia. We'll see what's called primary progressive aphasia, which is where the person begins to lose their language abilities, and then the other symptoms of dementia will start after that begins. So anytime aphasia always occurs, though, from injury to the brain, whether it be through a stroke, a non-traumatic form, or a traumatic, such as like a fall or some kind of accident. But usually stroke is the most common reason that we will see aphasia.
So how common is this?
According to the National Aphasia Association, approximately 25 to 40% of people who suffer from a stroke will have aphasia. According to the American Speech Language Hearing Association, it is more common for older adults, those over 65, to develop aphasia after a stroke than younger adults. And then I don't have the statistics from traumatic brain injuries, how often those do get aphasia. It is less than from a stroke, I know, though.
Okay, so what's your diagnosis criteria?
Well,
yeah. So we do have standardized tests that we do as speech-language pathologists that can assess for the type of aphasia and the severity of aphasia. So the testing that we do will look at the receptive language, which is the comprehension of language, and then also expressive language, which is how well the person can communicate or express themselves. And then based upon the results of that test, we can determine what type of aphasia they have and how severe that aphasia is. A physician can also diagnose aphasia as well.
So I have a question that's maybe ahead of itself, but so if you're quizzing me with your criteria to try to determine if I have this particular problem after a brain injury, is it reasonable to assume that I could sit down in front of a computer and type out your answer and it'd be cool, but I just couldn't express it verbally? Is that an option, or is that not always consistent with every person?
So generally with aphasia, if you have difficulty expressing yourself verbally, you would also have difficulty expressing yourself through writing.
Okay.
So unfortunately, generally if a person couldn't say it, they'll also have a great deal of difficulty writing or texting their answers as well.
So we can't, a patient can't sit before you who's having speech difficulty, and you basically can't put a piece of paper in front of him and have him recognize what you're trying to say to him or trying to get him to say. Is that
Again,
you know where I'm going here?
I think so. It's variable. Many of my aphasic patients might understand better if I give them a word or a picture. It just helps clue them in as to what I'm trying to go for. I may use gestures as well. That's a real good facilitative technique where if I gesture something, they may be able to understand it. I don't know if that answered your question or not, but we can use reading to help comprehension.
I guess how I should have probably said it was speech. You have a speech issue, okay, and you have a sort of let's call it a memory issue for no other term, but you can't fix it with a piece of paper or a book in front of them, okay. I mean, that's the same issue of brain recognition. You can't put it in front of them in print and expect to have them relate to you in an improved manner. Is that right? You're getting what I'm trying to say here.
I do, yeah. And again, I think it's different with every patient. Okay. I've seen patients that will read a sentence and then understand what I'm going for, so we can use that to help. Some do not.
But it's a process.
It's a process, yes, definitely.
I guess what I'm getting at is there's no way to fix this other than...
We can use compensation.
Other than oral working with the patient. Okay.
Mm-hmm. A lot of repetition, a lot of practice.
Do you give them homework? I mean,
yes.
Practice. I think I'd heard that before, that they do go home with repetition things.
Mm-hmm. I often say to my patients, I've got homework for you, and they make a face like I haven't had homework since I've been in school. So, yes, a lot of that.
How interesting.
Yeah, and one of the best things they can do for homework really is just to communicate with their family and friends. Sometimes if they're frustrated, they won't want to talk, and we encourage them, even if it's difficult, to communicate with their loved ones, because that in itself will help improve
sort of
their
refresh
language.
their memory. Is not the right word, but
definitely. Yeah,
rebuild their memory. I guess.
Yep.
Okay. Oh, interesting. Do we have in our brain? Can we move everything long term, whatever, to another place? I mean, I know that's going to take a long time.
Yeah, I mean, our brain can do wonderful things. The younger we are, the more plastic, they call it neuroplasticity, where we can use other parts of the brain that haven't been damaged to kind of take over and connect new pathways.
Okay. Okay. First break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Have you heard about Tap On It? It's a new way to get great coupons on your smartphone from all types of vendors. Hi, Paul White for the Medicine Center Pharmacies. So you text the words Tap On It, that's Tap On It, TAPONIT, 82928. Tap on the link that comes up, and up comes your coupons. The Medicine Center Pharmacy coupons are buy $30 worth of merchandise at the Medicine Center Pharmacy and get $10 off. You can also earn a free first aid kit. This is a great way to save money. Tap on it at the Medicine Center Pharmacy.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets, organized by date, time, with instructions clearly labeled. It's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Debbie Adams-Shumaker and Dory Moore from Mercy Therapy Services. Have a question? Post it on our live Facebook feed. You're getting those, correct?
We do not have a live Facebook feed, but it's
not live,
we have a picture on Facebook, so you can serve up your questions. I'm watching for them.
You can look at the ladies, okay? All right. Okay. Anyway, so there's supposedly 3 types of aphasia. Can you explain Broca's, is that correct?
Broca's. Yeah.
Or motor aphasia, and how it affects patients?
Sure. So there are 3 main types of aphasia, and then within those 3 types there are other subtypes. But Broca's aphasia impairs an individual's ability to express themselves. It's also called expressive aphasia. Sometimes it'll also be referred to as non-fluent aphasia, because with this type of aphasia, the patient's speech is not fluent. So they'll have a lot of hesitancies, a lot of breaks in their speech, because they're having a very difficult time getting the words out. So with Broca's aphasia, an individual knows what they want to say, and their comprehension is usually good, but they're just unable to express their answers, formulate their responses, and communicate their wants and needs to people around them. It can be very frustrating to people because they do have the awareness that they're having trouble, and they also have the awareness of what people are saying to them, but they are not able to express what they know. So a lot of times a person that's communicating with them will not realize that a person that has expressive aphasia or Broca's aphasia understands what they're saying because they can't answer back. Sometimes if someone has expressive aphasia, if it's severe enough, they might need a communication device, which can range from a low-tech device, such as a communication board, which has pictures that they can point to, or it could be a high-tech device, which is like a tablet, computer tablet, where they can actually click on pictures, use a touch screen, and the computer will talk for them. So there are some options if the aphasia is severe enough for them to do that.
Is that helpful for their rehabilitation?
It absolutely can be. We still want to work on the verbal output, but it can definitely help, aid in reducing frustration if they have a means to communicate via a tablet or a communication board also.
In the research that was presented to me by Nancy, there are more than 2 or 3 different kinds of aphasia. Is that correct?
That's true.
Yeah.
How did they come up with this? I mean, how many do I have in front of me? Like 6. I mean, is there more than that, or?
I think that's about right.
Yeah.
The ones we're talking about are probably your most common, but
Okay.
yeah, I think people put a lot of research, a lot of brain mapping, a lot of just observation of different symptoms, and then they label that.
So, different approach for different types of aphasia?
Definitely.
Oh, absolutely, yeah. If a person has Broca's aphasia, we're going to work more on the expression, so trying to help them get words out. Usually starting at the word level, if that's where they are at, and then building up to sentences. And eventually our hope is to work to the conversation level where they can communicate in a conversation and find the words.
What about an individual that speaks multiple languages? Okay. All right. So we have aphasia in an individual like that may speak 2 or 3 languages. What happens when you try to? I mean, does their brain fall back to Italian, or you know?
I have seen some of my patients revert to their initial native language. It's much more ingrained, I think, and more automatic than English as a second language. So I have seen them go back to that.
And that would be an individual who maybe was born in Italy and grew up in Italy.
Exactly. They came over, their family speaks it in the home. And therefore it makes it a little bit more difficult for us as speech-language pathologists. We sometimes will get interpreters involved in the therapy.
Amazing.
Yeah.
So, that's amazing. I've known people who speak 3 and 4 languages. Okay, so...
and then I've had a patient, it was a very frustrating case where he'd spoken 7 languages, very intelligent gentleman, and all his languages were wiped out. So
Gee whiz, kidding.
It can run the gamut.
Holy smokes.
What about how do you help support those people? Because I'm thinking the stress and the frustration and the depression, all these things have to be a factor. So I'm sure that's part of, maybe not your responsibility, but it's got to be part of the patient's therapy at some level.
Right. And I think a lot of our patients have a team, we work in a team approach. If we need to get a neuropsychologist involved or a counselor involved, we will. Many of our patients see occupational and physical therapy in conjunction with speech, so there's a multi-team approach. Educating the patient that they are going to go through different changes. They will be angry, perhaps, and they will be depressed. Yeah. Depression is a huge factor in recovery, and it's a normal process. Where it becomes abnormal is if we can't get through that stage.
Well, I would suspect that antidepressants kind of delay the help that you can give to a person, correct?
Not necessarily. A lot of our patients are prescribed antidepressants to help them increase their motivation, to kind of get over that hump. So it does help them.
I look at, we see a lot of people on antidepressants and tranquilizers, if you will, and things like that. And then it does sort of slow their brain, or probably that's too simple a way to put it. But
no, it can, yes. I think you have to work with the physician to find the right medication, the right dosage.
Second breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
The Half Off and Hot Buy store in Louisville just got in a new load of furniture from a major department store, and also lots of new drugstore merchandise from large drug chains. Of course, all this merchandise, furniture, and more is 50% off. And as a special gift to our loyal customers, we're reducing all of our furniture an additional 50% off. That's right, 50% off and an additional 50% off. Don't miss this Memorial Day sale. You'll regret it. The Half Off and Hot Buy store in Louisville. See us on Facebook or halfoffhotbuys.com. We continue to reload the Half Off and Hot Buy store in Louisville with new merchandise. Just in, ladies and girls Levi's, $48 value, $11.99. Beach towels, $5.95, and lots of coffee, K-cups, and more. You won't believe the prices for the Starbucks coffee. Also, we continue our special prices on furniture and many, many toys, health and beauty, laundry detergent, and much, much more. Don't miss this sale. You'll regret it. See us on Facebook or halfoffhotbuys.com. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing aphasia. We've got a lot more to cover this morning, so let's get back to the show. So, we talked about one type of aphasia. What about Wernicke's?
All right. So Wernicke's aphasia, I think, is the most difficult type of aphasia to recover from and work with. These individuals, it's actually called receptive aphasia or fluent aphasia. You'll hear it labeled both of those. They have a condition where they're not understanding any language, and they, even reading and writing, they can't understand what's being said to them. And also when they speak, it's fluent, but it's a lot of jargon. There could be nonsense words involved. Words aren't in the right order, but they have no idea that they're making these errors. They'll just be speaking at a normal rate, good inflection, good intonation, but not making any sense. So it's that feedback loop that they're missing. And it can be, again, I think, very frustrating for the therapist for this type of aphasia.
Would you say that the hearing is disconnected too on this, or what do we got going here?
The hearing is fine. The acuity of the hearing is fine. It's that connection for understanding the input.
Mm-hmm.
Can you give us a quick summary of which parts of the brain do what? I mean, I realize it could be lengthy, but, just a...
So the brain, typically the left side of the brain is the brain that houses language, and it's
that's my left side.
Yep,
okay.
Your left side.
Not yours, mine. Okay.
Yeah, well, everybody's.
Whatever.
Yeah.
All right.
So, and it's different areas of the frontal lobe, the temporal lobe, and the parietal lobe.
And the forehead.
Yep.
Okay.
Yeah. So when we have aphasia, typically one or two or three of those lobes will be affected, and depending on what areas of the lobes are affected, that's how a person will get either Broca's or the Wernicke's aphasia, depending on what specific very tiny area is affected, and that's what causes it. So, yeah, a lot of times that's why if we see a person that has aphasia and they had a stroke on the left side of their brain, they will often have weakness on the right side of their body. So a lot of times with the aphasia, they'll have paralysis in their right arm or leg as well, because the left side of the brain controls the right side of the body. So
okay, so we get a hand injury, we get a subdural hematoma, which is a blood swelling in the brain, the way I understand it. So that's sort of like a stroke too.
Sure. Especially the subdural hematoma, hemorrhages, they're all referred to as cerebral vascular accidents.
Yes, so depending on where in the brain it happened, they could get aphasia.
And I think the difference with brain injury is that it can be more diffuse. More areas of the brain can be damaged. If you get hit on the left side of the head, your brain bounces off the right side of the skull, and you can get bruising or tearing all throughout the brain. So
interesting. So what about global aphasia?
And I think global aphasia is the most severe type of aphasia. Kind of exactly what it says. Everything is affected. Comprehension, expression, reading, writing, but to a severe degree. The patient may have 1-2 words that they can say, maybe a stereotypic utterance, but their overall production is severely limited. So it's almost like they're kind of locked in. There's no communication. And it's very severe.
No solution?
They're to be able to increase means of communication, probably through other means. There's a specific therapy technique called visual action therapy, where we start out with just tracing objects. So the patient may eventually be able to make a crude drawing of something that they need, or then imitating gestures of the object. If we want to have them to understand the word cup, we would use a gesture, and they might be able to learn that. But the prognosis for that is less, again, than Broca's.
So for a second or so, let's jump back to concussions. You get all these football players that over the years, before the design of helmets has improved dramatically, and children, kids, adults now wear helmets on bicycles, and, as opposed to when we were kids. Hey, we never thought, we can't do that. That's
right.
That's chicken. That sort of stuff. So, how have they helped the football thing? I mean, in the concussion as opposed to a stroke. I mean, it is a concussion it's a bruise, isn't it? A brain bruise.
Mm-hmm. But it may not be as severe. The actual matter of the brain may not be as affected as much as a stroke. The blood supply is not completely cut off as in a stroke.
Yeah.
So you may not have that aphasia, but you can have other issues, memory, attention, all those can be affected. Just, ability to be alert, inability to handle any kind of stimulus that comes in. So that's a whole different animal, concussions, yeah.
Can a person have aphasia without a physical disability?
Yes, they can, yeah. Especially if the aphasia is caused by something other than a stroke. So they could have aphasia in other, like Debbie said, cognitive impairments, memory issues, or attention issues if they had a traumatic brain injury, where they have more diffuse injury to the brain that affects different skills. As far as physical disability, sometimes we will see that right-sided weakness with the aphasia, and other times we'll just see the aphasia by itself. So it does just depend, but it's definitely possible to only have aphasia as your only symptom after a stroke and no other physical disability.
So I know you've talked about that every patient is a little different and unique with their treatment plan and their recovery time. Can you give us maybe just one example for our listeners if they have a loved one that would happen to go through this, or maybe if they're going through it now after a stroke, you could discuss maybe what it looks like and how progress is made, and maybe what to expect to help the patient and support them.
And I think a lot of family support is what the biggest, family caregiver support really can help that progress. Initially, they would probably be seen by their physician or their neurologist. Therapy would be recommended, and therapy can also start early on after a stroke. We at Mercy, have a continuum of care. We see them bedside after the stroke to diagnose aphasia and start to work with that. Then they may move on to our rehabilitation unit, where they receive intensive therapy 5 days a week. And that would include speech therapy, physical and occupational therapy. And from there, the next step then would either be home care, if they're not quite ready to get out in the community, or outpatient therapy. So there's definitely a continuum of care there. I think letting the family and caregivers know that this is a process. It's not going to happen overnight. The injury happened overnight, but the recovery will not, and it takes a lot of time and a lot of hard work. So preparing them for that, I think, is important.
Do we have videos and things like that you watch?
Yeah, I believe the American or the National Stroke Association has a lot of good information on their website. The American Heart Association also has a lot of good information on stroke and aphasia. So those are two good resources.
Yeah.
Would there be reason to... So let's say the the patient, the individual, has a certain amount of motor skills and things like that, is there any point in teaching them back how to use their iPhone, cell phone, iPad, computer?
Sure. Yeah, I think that can definitely be a treatment goal, especially if the person used their phone a lot before, or a tablet, an iPad, and definitely texting or typing is a form of communication.
So what's important here is that the family brings forward to you what this person used to do.
Yes.
Correct.
Yeah.
Whether it's computer related or hammering a board or any of that sort of thing.
Yes, yeah, definitely.
With the idea that it might bring their memory back.
That, and I think it may be more motivating for the patient as well. It's more relevant for the patient.
Like, this is the painting that I made and I can't paint anymore.
Exactly. Yeah.
All right, interesting.
What about returning to your job? I'm sure that's a loaded question and individualized, but
I think for some people, they may be able to return over time, and a lot of times it's a good goal for someone to have to help motivate them if it's a job they enjoyed. However, if it is a job where they had to communicate a lot, they may need to go back to that job doing things slightly differently. If they were in a job where they didn't really need to communicate much, they may be able to go back to the exact same job, but it might be a lot more difficult if they had to talk a lot in their job before.
And I think also we're seeing more and more individuals, that are younger, in their 40s and their 50s and their 60s, and they were still working. When I first started my practice, most of my aphasic patients were elderly, above 65, retired, now we're seeing a lot different types of patients come through the door.
Okay, final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The Half Off and Out By store in Louisville just got in a new load of furniture from a major department store. And also lots of new drugstore merchandise from large drug chains. Of course, all this merchandise, furniture, and more is 50% off. And as a special gift to our loyal customers, we're reducing all of our furniture an additional 50% off. That's right, 50% off and an additional 50% off. Don't miss this Memorial Day sale. You'll regret it. The Half Off and Out By store in Louisville. See us on Facebook or halfoffhotbuys.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us today. Let's get back to the last segment of the show. So, Debbie, from a speech therapist perspective, what treatment options do you use at Mercy Medical Center to help patients recover from aphasia?
Okay, and I think we covered some of this prior
we hit a lot
to,
of this stuff
right?
already,
But we can have, I think the main goal for speech therapy is to try to restore the function of the individual to as a level of the most independence that they possibly can obtain, just to be able to do the daily activities of their life. That's our functional goal. Therapy can be restorative in nature, trying to, again, fix something that may have been damaged or eliminated, or compensatory, where we're going to use other things to help them communicate, whether it be gestures, writing. I had a patient once that actually drew very detailed pictures to communicate what they were wanting to say. So we generally really try to improve the strengths and act on the strengths of the patient and address their weaknesses at the same time. And when we talk, there are many different types of individualized therapy approaches that we can use based on the patient's disorder.
I would guess that one of the biggest problems is mobility. They've lost their mobility. They've lost their ability to drive or their freedom, if you will, to go here, go there. I think when I think of it myself, I think, gee whiz, but I hate to be not be able to go anywhere.
But we've had many stroke survivors and aphasics who regain that ability to drive again. And my big goal is to be able to give that person choices in their lives, so that as opposed to just somebody putting scrambled eggs in front of them, they may have a choice between, I want a fried egg or I want cereal. So being able to find different ways to give them choices and control.
I never thought of that. Your memory bank, the food that you liked before, it goes away, I guess, huh?
And that's where the family comes in very important, is to give us ideas. What are their preferences? What are their interests? So
Bobby, you liked this before. I don't like it. Does that happen? The taste, I would think the taste has to be disadvantaged at sometimes, too.
And I've heard that also. Some of my patients that loved coffee before, it tastes very bitter to them now, and they can't stand it.
Interesting. Well, why don't we talk about support groups before time gets away from us?
Okay. At Mercy, myself and Julie Dominic, who is our occupational therapist at the hospital, she also does all the driver's evaluations. We've been facilitating this group for, I asked her the other day, 25 years. I can't believe that. We started out, was one of our aphasic patients who wanted to just be able to get together with other survivors in her similar shoes to talk about struggles, successes. We started out working in people's homes. We would rotate every month, and we outgrew that. So we are now meeting, and eventually we outgrew some of our rooms at Mercy. We're now meeting at Bethel Church, which is at 711 25th Street next to Malone University. And we meet the third Tuesday of every month from about 6:30 to 8:30. Except for July. July we have a picnic, so we won't be meeting at that particular group or that particular location. And this is a great opportunity for folks, especially stroke survivors, their caregivers, family, friends, to come and talk about their frustrations, their success stories. We talk about stroke research, prevention. We bring in guest speakers probably 1 to 2 times a year to talk about certain topics. It's a great group, and they just thrive on that camaraderie when we get there. So that again, if anybody's interested in our group, they can contact myself at 330-489-1231, or Julie at the hospital at 330-489-1135, and we can give you more information about that group.
So patients and caregivers.
Oh, definitely, yeah.
Okay.
Okay, so we talked about different types of aphasia today. In the treatment process, are there basic things that you do with all of them, all categories, or is every one of those different?
I would say every one is different. Yeah, if somebody has trouble with comprehension, we're going to focus much more on treatment goals that will target that. So trying to have them understand yes and no questions, be able to follow simple directions. If somebody has trouble with expressing themselves, we'll focus more on having them try to label pictures or objects, do sentence completions where they fill in a blank, name different items in a category, So even though two people might have the general label of aphasia, their treatment plan could be very different based on the type of aphasia and how severe it is.
And your department does the diagnosis. I mean, this would be sort of out of the league of really any physician. I mean, would that be correct? Unless he has a specialist in this category.
Yeah, I think the physician will be able to say this patient has aphasia.
Yeah.
They definitely have that training and knowledge of what the symptoms are. But then, as speech-language pathologists, we get into the nitty-gritty. This particular aspect of their communication is disordered.
Okay.
So we can diagnose the type of aphasia then.
So you guys are the pros.
I hope so.
What about coronary bypass surgery? Is it likely to produce any... I'm not suggesting that they could have a stroke. I mean, maybe sometimes they do. I mean, my neighbor, one of the people I know, had a colonoscopy and had a stroke.
Yeah. Exactly.
So, I mean, anything can happen, I guess, in the surgical arena. So what about the coronary thing? The hearts, they shut the heart down, in some of the cases, that sort of thing.
Right. Yeah. I mean, the risk of stroke is there for coronary artery bypass, and those patients are always advised of that prior to. Hopefully that won't happen, but the risk of even a piece of plaque breaking off during like a carotid endarterectomy, that can cause a stroke as well. So it happens,
but not that often.
I don't think
I would
so.
suspect. Okay,
No.
I mean, really, what's happening here is we have head injuries that bring these people to you. Okay, of that sort, or a stroke, or whatever. So,
Right.
Okay, very interesting.
How about your contact info for listeners one more time, and where they can get more information about your speech pathology treatments? And I think you should repeat your support group numbers again, if you don't mind.
All right. Well, the support group numbers, they can call 330-489-1135, and that's our main hospital line. Or they can reach me at my office at 330-489-1231. We also do provide services at some of our off-sites. Again, our New Philadelphia and our Carrollton therapy departments, we provide speech therapy at those off-sites as well as the main hospital.
I think if anyone had any questions about our speech therapy services in general, again, the number to the main hospital is 330-489-1135. And at Mercy Medical Center, we do provide speech therapy at the inpatient level of care. So patients who are admitted to the hospital, we generally will see them if they come in with a stroke. We typically will see them the first day or two that they are there to do an assessment of swallowing and if they need speech and language and cognition abilities. We also have our inpatient rehabilitation center, which is housed within Mercy Medical Center, where the patients will receive more intensive therapy. They'll get 3 hours of therapy 5 times a week. We also have outpatient services there as well. And then, like Debbie said, we do have several off-site that provide speech therapy also.
So, support. Okay. Do you encourage conversation between the people coming to the support group, or tell me just in a few seconds, I guess. How does it work? I mean, here's people who are having difficulty communicating anyway.
Exactly, and those folks, I've seen them, and they will sit there and they will listen. They may not be able to participate in conversation, but they get a lot out of the conversation. And I think pretty much the group just takes over themselves. They're a great group, and they support each other wholly and ask questions of each and what their needs are.
Thank you very much, ladies. It's very exciting. Special guest Debbie Adams-Shumaker, manager and licensed speech pathologist at Mercy Therapy Services, and Dory Moore, licensed speech pathologist of Mercy Therapy Services. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. And as always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. See you here again next Friday, right on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies,